Our daughter Janene passed away at George Hill 3 years ago due to horrific neglect and inhumane treatment. Protocols in place and protections to safeguard her were not enforced. Lack of management, supervision, accountability, as well as falsifying records and reports led to her death. Egregious violations of policy and procedure caused this tragedy. We continue to grieve her loss every single day. Janene had mental health issues. She had extreme anxiety and paranoia. She was awaiting a hearing in George Hill because of missed probation meetings. Janene was not a criminal. She had no history of violence and no substance use. She never hurt anyone. She developed a brain disease in her late 20s, not brought on by herself, no different than cancer or heart disease. Yet, she was treated as a hardened criminal in George Hill. Instead of a prompt hearing, Janene languished in George Hill for 2 months without required mental health attention. She was assessed by the facility's psychiatrist, who documented her severe mental illness and need of treatment. Upon investigation, and despite having no history of violence and no documented misbehavior at the prison, Janene was put in solitary confinement, meaning 23 hours of being isolated daily in a cell. It was discovered that Janene was denied basic necessities. Her mattress, pillow, sheets, blanket, and towel were all removed. They threw food into her cell. Janene pleaded to see doctors and cried out that she was cold. She endured this for 52 days. The final 3 days isolated for a continuous total of 72 hours because it was a holiday weekend. One can only imagine how her mind was tortured continually with such treatment. During the investigation, it was discovered that there was no documentation of why she was put in solitary and no approval of this action. If someone is placed in solitary, a review and an assessment must occur within 3 days with the warden to determine if segregation is warranted, followed by a review every 7 days thereafter. Also, daily medical visits were required. None of these requirements took place. When the warden was questioned, he responded as though he had no responsibility for what occurred at George Hill. Isn't that his job? He even admitted that he was unaware of Janene's solitary confinement. Solitary confinement is designed for someone who poses a serious threat to others or security, not for someone like Janene, who was a threat to no one. Janene was 97 pounds, 5'2". She had grab marks and bruises on her arms, legs, and back. When she was pleading for help and could no longer stand the horrific conditions and taunting, she told the guard she was going to choke herself. The guard said, "Go ahead." Janene covered the window with paper, and the guard went to breakfast. The guard did not follow suicide prevention guidelines, which demanded continuous observation of Janene. Nobody observed her after the threat, and she died by suicide. Remember, Janene had no sentence. She was awaiting a hearing for missed probation meetings. The missed probation meetings were because she had paranoia and she was running away from her supposed attackers. Guards seemed to be able to treat inmates as inhumane as they wished, with minimal oversight from all levels. rather than observing inmates, especially those with mental health issues, the guards were found to be falsifying log records. People with mental illness, especially with no history of violence, should not be treated the same as criminals. At least 40%, and today I heard the number is even higher, of the inmates have mental illness. 10 months ago, an agreement was made with our family to include 11 new policies and revisions to the suicide prevention and restricted housing procedures. With the previous lack of oversight and accountability, we have no way of knowing if anything has changed. We appeared before County Council 2 times to plead for their interest and investigation into how George Hill actually operates day to day. They have a responsibility to Delaware County taxpayers who are paying for this horrendous $50 million contract with GEO. We never received any follow-up information from County Council. There have been at least 2 more documented suicides at George Hill since Janene's passing. There may have been more that we are not aware of. It is extremely difficult to obtain this information. We were also promised a meeting with the prison board in order to be assured that the 11 new policies were actually implemented. We are still trying to schedule such a meeting. It is up to the county to be aware and actually approve the management of George Hill and the treatment of inmates. It does not appear that this responsibility is taken seriously or again overseen. Accountability and oversight were sorely lacking 3 years ago, and since there have been more suicides, we question if anything has changed. Financial considerations of managing this facility are of concern to many. However, does anyone even know or care about the daily activities within the walls and how human lives are treated, especially the vulnerable ones? Since the prison board has not provided any verification or shown any interest in this, it is time for an outside, independent examination of what is actually taking place in this house of horrors. Our investigation uncovered gross lack of training, gross lack of supervision, and gross lack of accountability at all levels.